Thomas Aksnes of Health Optimizing is an extraordinary entrepreneur and a leader with Health Optimizing. He's co-founder and head of innovation. They've been members for a couple of years, and they were very impressive right from the get-go. And then more recently, as we started to understand more and more about what they do and how they work, it's been even more impressive. And in the last call that we did, we learned that he's been doing 100-hour weeks for 20 years. So has anybody ever said, oh, I've got to catch up this week, I'm going to do 100 hours, and you kind of map it out and do it for 1 week? And how significant that is. He's been doing it for 20 years, and he's been utilizing the technology that they have at Health Optimizing. So Thomas, you're amazing. Congratulations on your success. And so the picture behind you, I presume, must be some sort of a video. That's not really outside the back of your house, is it?
No, it's not. It is in Bergen, though. So it is very close to where I am.
It looks beautiful.
I have a green screen with a backdrop of the beautiful city of Bergen.
Well, thank you for staying up, which will eventually be after midnight for you. We look forward to learning more. Please go ahead.
Thank you very much. So let me share my screen. Can you all see it? I will assume so. All right, so I will be sharing about health optimizing and how we are building the future of health. But first, did you know that in the Western world, there's an average lag of 18 to 25 years from when a new technology is medically approved to when it's implemented in conventional clinics? 18 to 25 years. So just imagine your mobile phone, for example, 18 to 25 years ago, and compare it to the smartphone you have today. So the development of technologies in all industries have been really vast in this period, even exponentially. Yet in healthcare, the implementation is very, very slow. And the reason for that is that this tiny little box that we define as conventional is too small for these new technologies to fit within. So the box needs to change. And that is what we're doing in Health Optimizing. We are creating a bigger box where we can implement all these amazing advancements in technologies from all over the world. And we've been working with the technology developers and institutes for many, many years to develop our concept, to test the prototypes, and to build the concepts where we can utilize it. So it's a whole new box of medicine. And also, more than half the population of the Western world develop one or more chronic health problems. So I think that is a testament to how the conventional healthcare system do not have all the answers. And this is why we need to add, not replace, but to add more methodologies to be able to help the majority actually of the population who have problems that cannot be resolved conventionally. And beyond that, even those who don't have any chronic health problems, they still have a great untapped potential to optimize their health and to improve the quality of life. And we have the solutions for that, to find out what will make the biggest impact, to find out what the challenges are in the first place, but also to have the technologies to actually make a really big difference and to resolve those issues that are at hand. And we've been spending the last 24 years now researching and developing this concept and the methodologies. We started the first clinic in Bergen, very close to what you see in the backdrop here, 20 years ago in Bergen. And we have a proof of concept now from hundreds of thousands of clients through our clinics on 5 continents. So this is not just an idea. We have a lot of proof of concept for how this, the future actually already is a reality. To resolve health challenges and to tap into the potential in optimizing health beyond that, we need to get enough pieces of the jigsaw puzzle to see the fuller picture. So the human organism is extremely complex. So it's like a massive jigsaw puzzle. And actually the complexity of just one human being exceeds the complexity of any man-made technology up to date. So with the conventional methodologies for assessment, for diagnostics, there's actually less than 1% of these pieces that can be mapped out. And even though you can have a very high quality of those pieces, there's not enough of them to see what picture it forms. So when we can add our pieces of the jigsaw puzzle, and we also have many, many more pieces than what is currently implemented into conventional healthcare, then we can, in most cases, see what picture it forms. And it's not just about finding additional pieces of the jigsaw, it's also to have the expertise in how to put the pieces together and how to understand the picture. And that's really what we specialize in health optimizing. So the process, first we do a very comprehensive health assessment. We can measure today up to 20,000 health parameters at the same level of accuracy as normal conventional tests. And what we need to do when we find something that doesn't work properly is to find the roots of that problem, to find out what are the underlying causations that made it possible for this to develop in the first place. What are the triggers that trigger this development? And also, why didn't our self-healing, self-regulating mechanisms, such as the immune system and all these processes we have to deal with things, why didn't they resolve this when it was early emerging? So there's always a combination of causative factors, and we need to find all the primary to be able to fully resolve the problem. And then we make a personalized treatment plan where we address each of the roots of the problem with the best combination of methodologies for doing so, usually most of them technology-based. You can have 10 people with the same diagnosis and not 2 of them will have the same treatment protocol because they have different roots that were involved with developing the problem. We also look into what lifestyle factors are relevant for why this developed in the first place, and also what lifestyle factors are stealing the most of the capacity to just feel energized and to thrive and to optimize the quality of life. So after we fix the problems, we also help with how can we optimize health beyond that. So challenges that we frequently solve, what we have the most experience with is health problems that other solutions don't really exist for, different types of chronic illnesses, and word of mouth is so powerful for us there that we actually never in 20 years marketed our clinic services. But my philosophy is that we should be more proactive about health and that we should prevent health problems. And by doing so, by creating the capacity to improve health problems, there's also the capacity to be much more energized and to really thrive and to have a much higher quality of life, to age much slower. And this is really the future of health. The way I see it is to be much more proactive about health. And today we have the technologies to be able to do that. We also have a lot of proof of concept for dealing with athletes to solve their injuries much faster, to optimize their health, to be able to do much better, and to just improve their performance, to build up the ATP production in their cells, and all of these different aspects that are relevant for high performance. And I think that's a good testament of the potential in what we do when we've been able to help people win world championships in different sports. But I think it's for everyone really to optimize and be the best version of who we can be. And we like to really redefine the medical paradigm. And I will get back to that a little bit later. Our 3 core businesses, one is the health optimizing clinics. So we have a unique and complete clinic concept with 33 technologies. It's available through franchise and other partnerships, and we have extensive training and support. So it's like a turnkey operation to set up a clinic that can implement all the latest state-of-the-art technologies and the know-how for how to use them. The other business is the health status report, which is an assessment that we now offer for other clinics, for occupational health services, where we have, from our experience, developed an automated assessment and report system. So it takes about 15 minutes to do 8 different technologies. We get a lot of information from that, and then we have a software that can extrapolate that information and conclude on the most important aspects of the health, of the main functions of the body. And that is the starting point for them to be able to do other assessments to find out more, but also to know what factors are important to deal with to avoid things from developing further. We also have innovative health products. We have technologies to optimize even at the cellular level, and we have nutraceuticals to deal with very specific problems. And some of those technologies are also solutions listed into the health status report, so that this is all combined, where when more assessments are needed, health optimizing clinics or other conventional tests can do that. Some of the solutions will be through lifestyle, some will be through the innovative health products. So we're trying to really make an impact, and we're on a mission to redefine the medical paradigm and to make health optimizing solutions and clinics accessible to the entire population. And I think that's what I was able to say in these very few minutes. But we have more information on these different websites that you can see here. And I suggest to maybe take a photo of this so that you can get in contact with us if that will be of interest.
Fantastic. Thank you very much. And Tina, I got your message. We'll definitely get you connected. Does anybody have any questions for Thomas? We have several. Oh, you have a question. Okay, please go. Connie Kadinsky.
So Thomas, is it helping with neuropathy?
You're asking if it is helping with neuropathy?
Yes, and just figuring out what's causing the neuropathy.
What is
so
neuropathy?
Regardless of what the diagnosis is, what we do is to try to find out what the roots of that diagnosis is. A lot of times with neuropathy we can, and in those cases we can find out what's causing it. Usually those issues can also be resolved with a combination of the technologies that we have. We don't specialize in any specific type of diagnosis, and it always starts with a very comprehensive assessment. And from that assessment, then we know whether we can resolve this or not, based on whether we manage to find the roots of the problem and whether those are resolvable.
Did that answer your question? What should we know about that answer?
Well, a lot of physicians say it's idiopathic. They cannot figure out what is causing it. And my husband, it's numb feet. You can't feel your feet.
Yeah. So most things are so-called chronic or idiopathic or autoimmune, but in reality it's just because there's a lack of ways of finding out what's causing them. A lot of clients are also told conventionally that it's all in your head. But if you look at very, very few factors and then you make a conclusion based on that this is just your body attacking yourself, or it's all in your head, or we don't know what's causing this, it's from the lack of information. So I think this really highlights my point here, that we need to implement new methodologies and technologies in healthcare. And these methodologies already exist. We have the medical approvals for them. We have the know-how for how to use these technologies in combination. We have a clinic concept with extremely good success and a lot of proof of concept for that. So it's just a matter of bringing that to the world and implementing the new technologies, because as you pointed out there, it is lacking what is there today. Answers are lacking, and that's why that's actually the main reasons why things cannot be resolved easily, because you can only resolve things by the roots, and if you don't know what the roots are, then you can't really resolve it. Of course, it also comes down to having good enough methodologies to resolve the problems, but the starting point is to find out what is causing it. And idiopathic just means we don't know yet what is causing it.
Thank you very much, Thomas. What time is it there in Norway?
It's probably closer to midnight. Yeah, 11:38.
Thank you for participating, and a last round of applause here in the Zoom world and also here in the room.
Thank you.